Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about mitochondria. I'm really excited about mitochondria in general, and I'm particularly excited about them at this point in time because I'm going to be, as I mentioned in a previous post, I'm going to be interviewed by the Better Health guy tomorrow, actually, and then that video should be up probably in the not too distant future beyond that. And we're going to be talking all about mitochondria as it relates to complex chronic illness, sort of that umbrella term that would encapsulate things like persistent borreliosis, aka chronic Lyme, co-infections, chronic viral issues, mold illness, and electrical hypersensitivity syndrome. The list can kind of expand from there, heavy metals, things like that. And so I just wanted to put together a little video here, just kind of talking about this concept that I'm actually going to be talking about in quite a bit of detail, or to a significant extent at an upcoming conference that I'm going to be speaking at in Seattle, which is it's just for clinicians. But it's this concept, but I'll touch on it a little bit during my Better Health Guy interview, and I just wanted to touch on it here. And so it's ultimately looking at the mitochondria as kind of being this unifying factor or principle, if you will, of complex chronic illness. Using different sort of conceptual models when we're trying to sort out these really complex cases can be really useful, so that we can make sure that we are kind of staying organized on top of things, making sure we're not missing anything along the way that might slow down or stall out the improvement or progress that a patient might be seeing when they're trying to get better from these chronic issues. So looking at the mitochondria as kind of being like the fulcrum of that, I find is quite useful as I'm conceptualizing cases, because at the end of the day, your body needs energy to work. So every system in the body, I don't care which one it is, it needs energy. It needs ATP, which is cellular energy. And ATP/cellular energy is produced by your mitochondria. So therefore, the mitochondria are important. And so when a patient's presenting with symptoms that suggest that their mitochondria are suboptimally functioning, so low energy symptoms like being tired, their brain's tired, which is called brain fog. If they have issues with their muscles, so reduced stamina or endurance, or sometimes tight muscles, or pain can certainly be a manifestation of that sometimes. Those are all signs suggesting that there's an energy deficiency happening in their cells, and therefore there's a mitochondrial impairment happening. I'll go into a more comprehensive list of symptoms during my interview tomorrow, but that's kind of the general list. If you're tired, if you have brain fog, if you have muscle issues, then your mitochondria are probably not doing fantastically well. So getting back to this unifying principle, or unifying mitochondrial concept here, using the mitochondria as a unifying principle for complex chronic illness is what I'm trying to say. So where we need energy for everything to function, the mitochondria make that energy. So if a person is having symptoms of low energy, like I just mentioned, some of those symptoms, then it indicates to me that the mitochondria aren't doing optimally well. So the question mark at that point would be, are the mitochondria missing certain ingredients to actually be able to make that energy? And in my experience, a lot of the time the answer is yes. So we put patients on comprehensive mitochondrial support and they do better. But in some cases they don't do better, or they do better but they hit a plateau, and sometimes a plateau after they're only 20% better. So it would beg the question, well, what else might be going on there? Are there chronic infections that are ultimately having a deleterious effect on the patient's physiology and either directly damaging the mitochondria or interfering with the mitochondrial function, or just creating a lot of havoc in the body, a lot of damage, immune system imbalances, etc., where the body now has to waste a lot of energy trying to put out those fires, and therefore leaving the poor patient's body with not enough energy to feel good, to function. Therefore they're feeling fatigued or having muscle issues, brain fog, etc. So if we're supporting the mitochondria and the patient's not, stepwise feeling better until they're asymptomatic, if they hit a plateau or speed bumps along the way, then maybe there's something else causing those standing in the way of the mitochondria functioning optimally, making optimal amounts of energy. So it could be microbes like Borrelia or co-infections. It could be viruses inducing a cell danger response type scenario, and that's going to certainly step on the toes of mitochondrial function. It could be heavy metals, which are very toxic to the mitochondria. It could be potentially EMFs, which some research indicates that there's negative effects on the mitochondria from them. It could be other types of environmental impurities, could be excessive amounts of stress. The way that I'm thinking about my cases from a mitochondria-centric perspective is that if they're energy, brain fog, muscle issues, pain issues, certain other symptoms, which I'll talk about more during that interview, then if they're still present and if they're, if they're improved and hit a plateau or they never improved in the first place, then it begs the question, well, do we need to be supporting the mitochondria further, or do we need to start dealing with some of those roadblocks that might be interfering with mitochondrial function? That's not going after toxins, including heavy metals and microbes and mold and things like that. That's not a novel concept, but just thinking about it more from that mitochondria-centric perspective, it can help to explain why a patient might have persisting fatigue and brain fog and things like that. And then it also, at least for me as a clinician, it helps me to figure out or regroup and say, like, okay, well, if they're still having these symptoms, how are those mitochondria doing? Are we fully supporting them? Are we detoxing the mitochondria properly, et cetera, et cetera? So I found it to be a very useful theoretical construct in my practice, and I'm very excited about mitochondria.